Hey guys, it's Megan Overby. I'm a ULA for Dr. Kathy. The reason you can't see me is because I have a really old version of PowerPoint. So I went ahead and I inserted a picture of myself just so you know who you're listening to. But we're going to go ahead and get started. This should be the last part of your study session. So we're going to be discussing biomedical therapy and therapy effectiveness. So let's go ahead and get started. So we're going to do categories of drugs first. So you have 4 types of categories: antipsychotics, antidepressants, anti-anxiety, and mood stabilizers. Okay, so first is antipsychotics. Specifically, this is treating your individuals with schizophrenia, and this is because when they're in their active state, they are experiencing a state of psychosis. So we're trying to get rid of that. So just remember antipsychotic, antipsychosis. We're trying to keep that from happening. Basically, what this medicine is trying to do is block those dopamine receptors because individuals with schizophrenia have too much dopamine present in their brain. So we're just trying to limit that as much as we can. So you definitely want to be familiar with the examples of drugs that I've listed here because the exam and probably your quiz will have questions specifically dealing with like what kind of drugs treat what kind of disorders. So just be familiar. So the examples for antipsychotics are Haldol, Risperdal, and Zyprexa. Okay, so next is antidepressants. So obviously we're trying to get rid of depression, so this type of category is treating depression. Basically, the drug is trying to work to affect serotonin and norepinephrine, specifically increase the neurotransmitters because these are kind of like the happy neurotransmitters, so we're just trying to make them more prevalent in the brain. These are the examples I've listed, which is Prozac, Paxil, and Zoloft. What's really important to remember about them is that these drugs are SSRIs, and typically most antidepressants are SSRIs. Basically, SSRIs, how many times can I say it, means selective serotonin reuptake inhibitors, right? So we're trying to keep the brain from recycling or basically throwing away that serotonin norepinephrine and keep it present in the brain so that these individuals who are struggling with depression may feel a little bit better. Okay, next is anti-anxiety medicine. So, of course, what it's going to be treating is these anxiety disorders, right? We're trying to get rid of anxiety. Basically, this drug category is trying to enhance the effectiveness of GABA. GABA is just a system that calms your body down. And so some examples of these are Valium and Xanax. The last of the drug categories that we're going to be going over is mood stabilizers. Mood stabilizers specifically treat bipolar disorder, and that's because bipolar disorder causes individuals to cycle, so they have states of mania and then states of depression, right? So we're just trying to stabilize that mood so that they can feel pretty good most of the time and not have these really big cycles of emotions. Some examples of these are Depakote and lithium. Okay, we're going to go over some practice questions now. This is definitely a point to go ahead and really pay attention and maybe even take some notes just because these questions are what's going to be part of your Blackboard quiz. So just, pay attention and let's get started. So which class of drugs has provided help to patients experiencing auditory hallucinations and paranoia? Right, so auditory hallucinations and paranoia, those are symptoms of schizophrenia. And so if we can think back to which category of drugs treated specifically schizophrenia, we would know it's A, antipsychotic drugs, right? Because we're trying to get rid of that state of psychosis that these individuals are in, right? So the answer is A. Next is lithium has been found to be especially effective in the treatment of what kind of disorder? So if you can remember a few slides back, we discussed how lithium is one of the examples that treats bipolar disorder, which is D. So bipolar disorder is the one that has pretty big cycles of emotion, and lithium is a mood stabilizer. So we're just trying to keep them pretty even. So the answer is D, bipolar disorder. Okay, last question for this is Prozac, Zoloft, and Paxil are called what kind of drugs? This is kind of one of those memorization questions, right? So you need to be familiar with what types of drugs are associated with which type of category of drugs. So if you remember back, Prozac, Zoloft, and Paxil were all antidepressant drugs, and antidepressants are SSRIs, those selective serotonin reuptake inhibitors. So the answer is D. So the last little section we're going to be discussing is therapy effectiveness. So the first question I've posed is therapy effective? And yeah, of course it's effective. 80% of people who are actually receiving treatment have better outcomes than those who don't receive treatment. So if we're looking at no treatment or treatment, yes, therapy is very effective. So then the question is, which is better, medicine or therapy? And really, that's an answer of it depends. So sometimes medicine is better and more effective, sometimes therapy is more effective, and sometimes they're really effective when they're put together. So it really depends. Usually I say disorders that are more genetic and have more biological causes, such as bipolar disorder and schizophrenia, those usually benefit more from a medicine that can kind of correct the chemical imbalances and all of that. And then therapy can be a little more effective for like anxiety and depression. But of course, it's useful to have both combined. All right, so now we need to see if a therapy treatment is actually effective and how do we test that. So we do this thing called evidence-based practice. And what we're doing is we're looking at two and we're comparing the two. And it's spontaneous remission and placebo comparison. Spontaneous remission is where an individual recovers from whatever disorder they were suffering from on their own without receiving any treatment. So that would be like someone who has been waitlisted for a therapist for maybe 6 months. By the time they get to that therapist, they no longer need that treatment because they're not suffering from that disorder. The second one is placebo comparison, which is typically used in medicine trials. And basically what this is you have a drug that has the active ingredients, and then you have a drug that has the sugar pill. And you give it to participants and you say, here's this medicine, we think it's going to treat depression. And then we see if there's a difference between the people who are taking the active drug and the fake drug. And so, if there's a higher rate of recovery with people with the placebo, probably the drug that has active ingredients isn't that effective. And I think we have practice questions. Okay, so we're going to go over the practice questions. There's only 2. So Drugs R Us has been marketing a new medication to treat depression called Zyn. The company claims that their medicine leads to improvement in depression in 40% of patients who take the medication. Unfortunately, 40% of people taking a sugar pill in that same study have also had improvements in their depression. So this shows that Zyn is no more effective than your placebo treatment, right? Because the people who are taking the fake pill, that sugar pill, and the people who are taking the actual medicine are having the same rate of recovery. So that means that that medication with the active ingredients isn't having a better or more effectiveness to it. Okay, so this last question. Even though Ava did not receive any treatment for her anxiety, after 6 months, she noticed that she was no longer experiencing any problems with her anxiety. She experienced what kind of thing of her symptoms? So this is going to be when I was talking about that spontaneous remission, right? So she recovered. She learned how to cope with her anxiety and wasn't experiencing any problems on her own. She didn't receive any treatment. So that's a spontaneous remission.